Hello, it's Tuesday Talk from AIYANA Aesthetics, and I'm Rebecca Kelly, nurse practitioner. And today I'm going to talk about lip lines. So there's been a lot of talk out there recently because there is this new cup, the Stanley Cup, that has a straw, and it's this new trend that everybody's wanting to get their hands on. It's sold out everywhere. And so this just brought up a lot of questions and comments about lip lines, and so I wanted to address that. When you use a straw, you are contracting the muscles around your lips that are actually making those lines. So it's the same thing if you do like a little kissy face. It's also the same lines that we like to call smoker lines, because when you smoke, you have that in your mouth and you are making that puckering motion. So you're doing the same thing if you are using a straw all day long. So what that means is that if you're using a straw, you add a higher incidence of getting those smoker lines. And I have patients and clients come in all the time saying, I don't smoke. Why do I have smoker lines? And so we talk about it. We talk about if they're using a straw, that can cause it, and 9 times out of 10, that is what is happening. So I wanted to talk about this and really bring it to light and to let you know that straws are a no-go and you need to literally ditch them all. I have a big cup that I use, a metal cup. It's a hydro flask, and it just has the opening at the top. I don't use straws. Very rarely will you ever see me using a straw because I do not want to get lip lines. And the reason being, obviously, that's not something that you want to have on your face, or those deeper lines, but also they are honestly the hardest thing to treat. And there's a couple reasons why. Number one, they're around your mouth. That area is super sensitive. Those lines are so tiny. And if you go to fill those lines, you end up with like that kind of face. It gives you a distorted upper lip, which you've probably seen some people who have this, and it just makes their upper lip more rounded than what is naturally how it's supposed to be. And I'm like looking here because, as you can see, the upper lip should almost be like a ski slope. Okay, when you start filling that, you're actually getting like a little hill. So it distorts the upper lip if you try to fill those lines. So we look at other options on how to treat them. One that we've been super successful with is lip filler. And the reason being, it's not that they're wanting, plumper lips. It's because if you add volume to the lip line, you actually are able to spread apart those lines that are causing the smoker's lines. And so it actually softens them. I will show some pictures with this to show you how that works and to see it on some of our patients who've had the smoker's lines and we've filled their lips. They don't have huge lips, which by the way takes 3 to 4-ish syringes. Usually we're just doing one syringe, really outlining the border of their lips, and then that is what's giving them that softening of those lip lines. Another option is microneedling. So what microneedling does, we would do your whole face, but we'd really focus around the mouth. And what you're doing is creating that injury in the skin, which then signals to your brain that it needs to fix it. And when your brain is fixing skin issues, it likes to send collagen and get the collagen to activate there. So we do the microneedling treatments, and we've been super successful in softening those lines, okay? Another option is Sculptra. Sculptra is injected into areas of volume loss on the face, but we can really focus more around the mouth, adding a little bit more of that Sculptra in there. And Sculptra is our favorite anti-aging treatment because it helps produce more collagen in the skin, which a lot of the fine lines, wrinkles, deep lines, skin laxity, all that is from collagen loss. So Sculptra is going to go in there and it's going to build more collagen, which then is going to help with those lines. We love collagen here, so it's just the best. Of course, wear your sunscreen. That is going to help prevent you getting more fine lines and wrinkles, and that goes for around the mouth. You got to make sure that you're applying and reapplying every 4 hours. And then of course, skincare. So skincare is going to help soften those lines. It's going to help produce more collagen, and it's going to help with those lines around the mouth. So lip lines, hard to treat. so much easier to prevent than to correct. So that's why I talk about that cup and with the straws, because if you could stop using straws today and never use them again, you will be better off because you are preventing them from ever happening. So thank you for joining me today. I hope you have a great day. Make sure that you subscribe, like and comment, share our video, and we will see you next time.